Hi, my name's Dr. Katharine Jones. I'm the founder of Wildness Health. I've been a GP in the NHS for over 20 years, and I'm delighted to be here today at the Sustainable Healer Conference, my biggest event to date. It's been a really amazing experience. It's been, I started off with an idea 8 months ago of arranging this event, and was quite kind of nervous about how that might be received. And it's felt like the momentum has just sort of gathered over the months, really. And had a really wonderful response both from the speakers and then from the people who've signed up to attend. So it's been really, really uplifting experience for me. Yeah, and people have engaged in the event in exactly the way I was hoping. So yeah, it's been wonderful. When I was arranging the event, one of the things I was most mindful of is that we were not going to be giving people facts, but we were going to be asking them to question some of their beliefs and probably unlearn some of their beliefs that they learned during their training. And that's quite a scary thing to do. So when we were planning it, we thought a lot about how we could create an environment of safety. So we had people meeting guests at the front door, and we put a lot of thought into that. We had a yoga teacher present at the start of the event to do some breath work to help everyone relax, and to really help people kind of enter that space where they can be open to new concepts and share experiences they had. And I think the fact that people shared some quite tricky personal experiences, in a room full of 65 people that had only just met for me, is a success of the event. So one of the main things that we covered during the 2 days was the idea of a six-step framework of how we can change the way we practice. And the first 3 steps were all about creating a safe environment for the patient and a trusting relationship, but a peer-peer relationship rather than the doctor being seen as the expert or the health professional being seen as the expert. And then the second phase is really about motivating and energizing the patient so they can take radical responsibility for their health. So a lot of what we've been talking about yesterday was really about scene setting, helping people relax, get to know each other. And then today has really been about thinking about how people can integrate that into their roles. And we've got people from secondary care, primary care, community services, the third sector. We've got nursing students and resident doctors. We've got a real range of people. So it's really how people can then take that away. And the last session that we're about to do just shortly is called Note to Self. And that's really spending an hour for people thinking about all the stuff they've heard, different things will resonate with them, and getting them to write in the blank notebook that they got at the start of the conference how they want to start putting that into their life. So taking radical responsibility for their actions, empowering the people they facilitating self-empowerment in the group they're working with, but also provoking others to take action. So we've just heard from Professor Paul Garner about the evidence base supporting this approach to care. And when people go back to their workplace, that's what's going to be really important, is when they start saying, why don't we try doing this? And their boss says, no, or show me the evidence. That's the kind of appropriate questions that are going to be asked. We can't just make changes using public sector money without having an evidence base. So I hope we've given people a framework that they can start to think about that in a way that feels manageable and meaningful to them.
Hi, I'm Marissa D'Andrade. I am based at the University of Edinburgh, where I run the Realities Consortium, a UKRI-funded consortium tackling health disparities by reimagining health systems. I'm also a co-director for a philanthropic hub called the Binks Hub there, which tackles inequalities through participatory methods and arts. And I'm really passionate about systems change. It's incredibly important to get like-minded individuals together in a room. So you realize that actually it's not just me who's thinking these things, and it's not just me and my sphere of influence, but actually there's a mobilized force. There's a bit of a social movement of people who are thinking about these issues. For me, they're really systemic issues, and the system sometimes makes us think that it's about the individual, and that if you do something a bit different, then maybe you're a bit odd or a bit crazy. But actually, when you put a group like this together, you realize, no, hang on, there's a bigger picture here, and there's a greater story to tell. I'm really interested in systems change. And so I run a program called Realities. It's UKRI, UK Research and Innovation Hub. It's a transdisciplinary grant where we're interested in reimagining systems. And so I was asked to come here and talk about concepts. And my concept that I'm playing around with is something which yesterday I called visionary health. And the thinking is that I am the system. If I change, and everything within how I show up in the world, what are my rituals, what are my practices, how do I interact with every single person in every single conversation, there's a ripple effect. So I am part of the system, and if the system is broken, if the system is traumatized, if the system has got issues, I'm not saying it doesn't, but I'm in it, and so if I change, the system changes, right? It's the law. Part of what we're really interested in realities is actually scooping together, which we are going to be doing, understanding what people who work in the health system or connected to the health system, what changes do they want to see practically, and actually collecting that, right? And there's going to be 60 different variations there, and there will be some patterns, and we'll synthesize and we'll have a look at it. But ultimately, once we know what individuals within these systems want and what they feel are the blockages or what they think might be the enablers, then what we have is, certainly through our consortium in realities, is the opportunity to make that change happen. Right. So actually, this for us is a very practical process of, okay, if that's a problem, we can come up with solutions. And these can be very simple solutions, or much more complex, perhaps, for like lobbying HM Treasury for more money for creative health, but everything from small interactions to the bigger systems piece as well.
Hello, I am Professor Sally Lewis from Wales. I was a GP for 24 years, and I am now a Professor of Value in Health and an independent consultant. I think the biggest takeaway for me is that we know we're all wrestling to meet people's needs, and when we're not meeting people's needs in the community in the way that we want to. And what I've taken from today is that there is actually hope, that we can start to help people in a much more meaningful way, and that doesn't just help individuals, it's also good for the professionals, and it's also good for the healthcare system, because we will be creating less of a drain on hospital services, for example, if we're actually meeting people's needs in the community. I think that clearly there's a growing movement around the approach of lifestyle medicine. As a GP for 24 years myself, I feel that this is taking me back to the roots of my original training, actually, and that holistic approach to care of patients. So I think this is a revival, shall we say, which is really encouraging. And for me now, the next stage is to take this grassroots revival of what medicine and helping people is really all about to the decision makers at the top of healthcare, because they really need to understand that this is part of the solution. I think it was truly humbling to hear the 3 accounts from people with lived experience of chronic pain and functional neurological disorders. I remember having to try to help many similar patients in my practice, and I remembered my failures and I cried.
Well, I'm a GP by background, practiced for nearly 25 years, but I've got a specific interest in health coaching, which is a way of enabling patients and staff as well to have the biggest impact they can for themselves. So mind-body medicine is so much around the kind of like the way that people discover themselves and discover their own strengths. And I think coaching is a great way of doing that. And I'm an advocate for everybody picking up those skills, be they a healthcare professional, a patient, or anybody else in between.
I mean, I'm really, really, really pleased. It's been a massive project for me, and it's by far the biggest thing I've done. And I said to, at the beginning of yesterday, I said, when I was thinking, what does good look like for this event? And it was this beautiful venue, filled with natural light and people from right across the system who, open to think about things differently and have engaged in a really constructive way with each other and made wonderful new connections. Hopefully you can feel that in the room. And I think that whole thing about trust and safety and recognizing that for ourselves, we need to think where we are with ourselves. Now these tools can help us. We are people too. We're not just health professionals who are kind of bots. So yeah, I've been really, really pleased with how it's gone.